Welcome to Healthcare Channel. Type I hypersensitivity, also known as IgE-mediated hypersensitivity, is an exaggerated immune response to harmless substances such as pollen, dust mites, or certain foods. This type of hypersensitivity is caused by the production of immunoglobulin E, IgE, antibodies by B cells in response to the presence of an allergen. The IgE antibodies then attach to mast cells and basophils, which are white blood cells that are found in connective tissue and blood vessels. When the allergen re-enters the body, it binds to the IgE antibodies on the surface of the mast cells and basophils, causing them to release histamine and other chemicals that trigger an inflammatory response. Causes of type I hypersensitivity. Type I hypersensitivity can be caused by a variety of allergens, including pollen, dust mites, animal dander, certain foods, such as peanuts or shellfish, insect venom, and certain medications, such as penicillin. The exact cause of why some people develop allergies and others do not is not fully understood, but it is believed to be due to a combination of genetic and environmental factors. Symptoms of type I hypersensitivity. Symptoms of type I hypersensitivity can range from mild to severe and can include 1. Itchy, watery eyes. 2. Runny nose and sneezing. 3. Skin rash or hives. 4. Swelling of the face, lips, tongue, or throat. 5. Difficulty breathing or wheezing. 6. Abdominal pain, diarrhea, or vomiting. In severe cases, type I hypersensitivity can lead to anaphylaxis, which is a life-threatening reaction that can cause difficulty breathing, a drop in blood pressure, and loss of consciousness. Pathology of type I hypersensitivity. Type I hypersensitivity is characterized by the activation of mast cells and basophils, which release histamine and other chemicals in response to the allergen. Histamine causes the blood vessels to dilate, leading to increased blood flow and permeability. This allows white blood cells, such as eosinophils and neutrophils, to migrate to the site of the allergen and cause further inflammation. The release of histamine and other chemicals also leads to the symptoms of type I hypersensitivity, including itching, swelling, and bronchoconstriction. In severe cases, the release of histamine can cause a drop in blood pressure and lead to anaphylaxis. Diagnosis and treatment. The diagnosis of type I hypersensitivity is usually based on a patient's medical history and physical exam. Skin prick tests and blood tests can also be performed to identify specific allergens that may be causing the allergic reaction. The most effective treatment for type I hypersensitivity is to avoid the allergen that is causing the reaction. Antihistamines and corticosteroids can also be used to alleviate symptoms such as itching and swelling. In severe cases, epinephrine may be needed to treat anaphylaxis. Prevention. There is no known way to prevent the development of type I hypersensitivity, but there are steps that can be taken to reduce the risk of developing an allergic reaction. These include avoiding known allergens, keeping indoor areas free of dust and mold, and practicing good hygiene to prevent the spread of viral infections. Conclusion. Type I hypersensitivity is a common type of allergic reaction that is caused by the production of IgE antibodies in response to an allergen. The symptoms of type I hypersensitivity can range from mild to severe and can include itching, swelling, and difficulty breathing. The pathology of type I hypersensitivity involves the activation of mast cells and basophils, which release histamine and other chemicals that lead to inflammation and other symptoms. The most effective treatment for type I hypersensitivity is to avoid the allergen that is causing the reaction, and antihistamines and corticosteroids can also be used to alleviate symptoms. Thanks for watching. Subscribe now for more information.